That's good.
Brilliant, thank you. So thank you again for the introduction. I'm going to be talking about asking and talking about alcohol in pregnancy and breastfeeding. I'll talk a little bit about FASD or FASD, but Sophie and Angeline will be able to sort of provide a lot more detail in that area. So you might be aware the NHMRC alcohol guidelines were revised in 2020. And there are two guidelines that are relevant to pregnancy and breastfeeding. First of all, that to prevent harm from alcohol to an unborn child, women who are pregnant or planning pregnancy should not drink alcohol. And that's a clearer message than the previous guidelines, which sort of talked about, it's safer not to drink. The second guideline relates to breastfeeding, where it says that not drinking alcohol is safest for your baby. So there's been, new resources around implementing these guidelines and a new awareness campaign called Every Moment Matters, which we'll talk a little bit about. But I'll be discussing these guidelines and some of the issues that relate to asking women and their partners and families in general about alcohol in pregnancy and some of the things to, I guess, be aware of and to look out for. So how prevalent is prenatal alcohol use in Australia? Well, the National Drug and Alcohol Survey, which is an anonymous survey of households, indicates around 35% of women consume alcohol while pregnant. But if you just look at women who didn't know they were pregnant, 55% report drinking before they knew they were pregnant. And of them, 14% report drinking alcohol after pregnancy is confirmed. Overall, 1 in 2 of that group reported drinking alcohol while breastfeeding. So these are fairly significant numbers. What do we know about alcohol in pregnancy? Well, alcohol is a teratogen. It crosses the placenta, and a teratogen is something, as you probably know, can cause fetal abnormalities. So although there are other substances that might be toxic in pregnancy, teratogens are the ones that really do the more significant damage, perhaps than other drugs that women or families might feel are, more harmful or should be more harmful. And alcohol sometimes goes under the radar a little bit. We know that alcohol consumption at any stage of pregnancy can lead to adverse pregnancy outcomes. In the very early couple of weeks, this might be miscarriage, but it can also cause prematurity. Many babies are small for gestational age or have a low birth weight. Prenatal alcohol exposure can also cause FASD or FASD, which is a lifelong neurodevelopmental condition, and it has both brain and bodily impacts. Physical effects can include facial features, and many people sort of think of FASD as something that is about facial features, but we know these are only present in around 13% of individuals. So it's really important that we stop thinking about it as a facial dysmorphology condition, even though that was what led it to be sort of recognised, I suppose, as a condition in the early research, because those facial features were distinctive. But we've since learned, since 1973, when that was first coined, that there are many other effects that don't show up in the face. FASD is considered the leading preventable developmental disability in Australia, and it can lead to challenges with physical and emotional development, difficulty with language and speech, learning problems, memory, attentional issues, and difficulty regulating behaviour. There are also a range of long-term physical health risks for individuals with FASD, cardiovascular, metabolic, allergy, immune problems, because alcohol affects the whole body, and all of the systems in the body are vulnerable to alcohol at different times of gestation. There are some critical periods of pregnancy that are particularly sensitive. The very early weeks 3 to 8 of pregnancy are the point at which many of the structures of the brain are forming, and those cells that are going to go on and develop those structures are particularly vulnerable to alcohol. We think, for example, that the facial features are most vulnerable to alcohol, or the cells that go on to form the face, at around day 18 to 21 of pregnancy. But that early 8-week period is when we see things like cardiac abnormalities and physical features. But it's really important to know, of course, that the central nervous system develops throughout pregnancy, and there are some structures in the brain that are more vulnerable at 20 weeks, for example, of pregnancy. What is the risk of FASD? Well, The effects of alcohol in pregnancy are dose dependent. So the amount and the timing of alcohol during pregnancy will influence the severity of the effects. But this impact is also influenced by factors including maternal genetics, her health, whether there's smoking as well, maternal diet, age, and environmental factors. There have been low levels of alcohol consumption associated with FASD, and we think that some individuals are more genetically vulnerable than others to particularly low levels of alcohol, and we can't predict who those individuals might be. So that's why the guidelines are quite clear that there is no safe level, and I think this is something a lot of practitioners are asked as well, you know, how much is too much? And the really clear answer from the science is there is no safe level, because although, you know, women might feel that, you know, well, my sister had a few drinks and her kids are fine, and often anecdotal evidence is what does guide decision making. You know, there have been cases of kids with FASD whose parents consumed maybe, you know, one instance of alcohol in the pregnancy at a critical moment. In terms of breastfeeding, we know that alcohol passes into the breast milk. It actually restricts supply and flow of breast milk, so that can lead to its own issues. It can disrupt babies' feed and sleep patterns, but most importantly, it can also affect brain development. The alcohol content in the breast milk will pass into the baby's bloodstream. So who's at risk of using alcohol in pregnancy? Well, probably the biggest risk is an unplanned pregnancy. As you saw in those in that study, you know, over 50% of people who had unplanned pregnancies had also consumed alcohol, which is a pretty high rate when we look at world rates. Binge drinking prior to pregnancy, and a binge is, you know, 4 or more drinks in a session. So it's not a massive binge. It's a, you know, half bottle of wine. Smoking increases the risk. It's also associated with women on a higher income, women with tertiary degrees. Different thoughts about that. Perhaps it's because women have, you know, done research and feel that they're particularly low risk. There are other studies that suggest that women who've been to university have spent a lot of time socially in a binge drinking culture. And being exposed to abuse or violence is also a risk. There are different factors influencing whether women and their partners use alcohol during pregnancy. Individual beliefs is one factor. A lot of people believe that it's only harmful in certain types or certain doses, or they believe that it's less harmful than other substances. So they might cut back on one thing, but continue with another without necessarily having all the facts. Culture has an influence, social acceptability, pressure to drink. Some women describe feeling pressure to drink because if they don't, people ask them if they're pregnant and they're not ready to tell people yet. And the sort of cultural beliefs, you know, these are the things that, you know, well, this is my family say, or my friends, or my social network, my peer experiences. Knowledge and advice is really important. In the past, there has been a great deal of lack of awareness of what exactly are the effects on the fetus. And women report either insufficient or mixed advice from professionals, and particularly not enough evidence. They might feel there's not enough evidence about harms of low-level alcohol use. The pregnancy circumstance also is a factor. If a woman's experiencing abuse or trauma, alcohol can be a coping mechanism, or the pregnancy could be unplanned, or the person might have a dependence. And then there's also beliefs about alcohol in breastfeeding, that it increases breast milk. I think that's blamed on the Guinness Corporation, some campaign they ran in the 50s, but the belief that alcohol has a sedative effect on babies, or just being unaware. There was a famous painting from the 1700s called about gin lane and gin babies in England. I was looking this up online one day, and when I looked up gin baby, I found gift boxes for new mothers with boxes of gin in there, bottles of gin. There's very much a culture that having a birth is associated with alcohol consumption. Health professionals in Australia do play a really important role. This study in 2020 found that 99% of women said they wanted to know about the effects of alcohol, It should be readily available, but only half of them had actually seen any such information. They nearly all agreed that health professionals should give advice on how many standard drinks are safe to drink in pregnancy. And over 90% said that women should be advised to give up alcohol if they're planning pregnancy. However, even among this group, 32% plan to continue some alcohol use, and 27% intended to continue consuming alcohol if they did become pregnant. So we're quite capable of, I guess, living as humans with these mixed ideas. We feel that we should be told, but we also feel that we can make our own choices. There have been a couple of studies about, the number of professionals who really feel competent and equipped to ask women about alcohol in pregnancy, and often that's not the case. There are a number of studies that show health professionals don't ask, maybe because they're worried of stigmatising people, they're not confident in asking the question, or they're not really sure of the accurate information. So the RACGP guidelines for preventative activities in general practice so that every woman of reproductive age should be considered for preconception care. And this should include advice to consider abstaining from alcohol, especially if they're planning a pregnancy or if there's the possibility, I guess, of an unplanned pregnancy. It's important to not assume that the person knows. We saw that many women haven't seen this information, even though it's sort of generally thought to be known in the culture. There has been limited sort of printed visual information until more recently. There are a lot of contextual factors that influence alcohol consumption behaviours. So it's really important to avoid judgment, stigma and shame. And I'm sure our other presenters will cover off on those topics. It's important to ask about what was the alcohol use before a person knew they were pregnant and after they found out they were pregnant, as there's likely to have been changes. But if we simply ask the question, did you drink alcohol in the pregnancy? They might say no, meaning no, when I found out I was pregnant, I stopped. And that misses that early period. So it's really important to ask about whether the pregnancy was planned or unplanned, how many weeks pregnant the person was when they found out, and what health changes they made when they discovered they were pregnant. We know that generally people in general underreport their own alcohol use. The National Drug Strategy Household Survey has been found to underestimate alcohol consumption by about 33%. There was an interesting study comparing Australians and Americans being asked about their alcohol use. And they were asked how many drinks they would have in a week or a day or whatever, and then how many standard drinks that would be. And the Americans who might have had 5 drinks said, oh, that would be 8 standard drinks. The Australians said, oh, 5 drinks. Yeah, that's 5 standard drinks. And so Australians were not very good at differentiating between a drink and a standard drink. And there has been really good research to show that asking people about special occasion drinking increases the likelihood that binge drinking episodes will be discussed and reported. In the official data, so on the left, we've got the National Drug Strategy Survey. This is what women say when they're asked on the phone. This is on the right. This is what women say when their midwife asks them in a hospital appointment. So according to the national data, only 2% of pregnancies in Australia are alcohol exposed. And if you are the policy people in that area, you could be thinking, well, this is not a very significant number. These women are obviously quite well educated, not just women, families, parents, partners. The Audit C is the preferred tool for assessing alcohol use in pregnancy, and it comes along with a standard drinks guide. And so by asking these 3 questions, we can come out with the standard score, which does allow us to classify whether here we've got a risk of alcohol-related harm. In the FASD guidelines, we have a risk of the risk level of alcohol use that could contribute to FASD, even though we're not entirely sure what that risk level is. We still would look at whether it's a moderate risk. So when we ask somebody, how much have you been drinking, or what have you been drinking? Someone says, I have a glass or 2. What we need to think about is a bottle of wine. I thought a bottle of wine was 7 drinks, but it's 8. 750 mils at 13% alcohol is 8 standard drinks, and the drinks are only 93 mils per glass. So this is what the guidelines say is a standard glass of red wine. This is what a restaurant typically serves, 1.6. This is another image because I thought that actually looks like quite a full glass of wine. So that's 100 mils in a wine glass. These are the ones I prepared at home using cranberry juice. That's actually 95 mils. And I think if you were out at a restaurant given that drink, you might think it was a bit small. Oh, sorry. I went back. No, how do I go backwards on this? Sorry, my apologies. But here we go. So that would probably be, if you were pouring a drink for a friend or for yourself, that might be more of the size that you would pour, which is actually on the left, it's 2, and on the right is 1.8 standard drinks. Someone says a glass or 2 of wine could actually be 4 standard drinks. And they're not large glasses. These are quite small wine glasses. This was a case in the clinic that I work in. I was reading files. I do a lot of digging for prenatal alcohol information in maternal histories. And this parent had reported consuming 4 drinks a day in early pregnancy, and it was recorded as 4 standard drinks per day. A few days later, another case note said 4 cans of spirits per day. So I calculated, okay, 1.4, that'll be 5.5 standard drinks. And this is what the guide shows us. So you can see cans of spirits really vary. The size of the can, who knew there were so many sizes? And so it could be anywhere from 1 to 2.4. But we'll say 5.6 for now. The next day, I noticed another record, during an admission where she said 5 cans of spirits a day. So 4 to 5 drinks a day. We're now up to 7 standard drinks. Later on, I found a final note which said, so that's your sort of 1.4 standard drinks that I was calculating on. Later on, she said she would typically drink 4 to 6 cans per day of 8% premix. So we're now looking at a can that is on that very high end of 2.4 standard drinks. So we've gone from her having 4 standard drinks a day to having between 9 and 14, because this particular can is 8% alcohol. So we have to, I guess, get a balance between interrogating women and asking for information that's actually going to help us ascertain their level of risk of having not the level of risk of FASD, but the level of risk that they will be drinking alcohol in the pregnancy or that they have been. And so it may not be that we, sometimes people might want to use the images, but other times you might say, well, what sort of drink, what are you having? If they say, I have a bit of wine with a partner. Okay, so how many glasses would you get out of a bottle between you? Oh, 6 glasses. So that just gives you a bit of an idea of alcohol content, I guess. It's important to provide advice based on the level of risk in the Audit C and discuss the alcohol guidelines and what the risks are. It's important to give positive feedback about being alcohol-free and reinforcing that it's good to stop at any time. And there might need to be an ongoing discussion about readiness and confidence to abstain from alcohol. When we look at women who continue moderate levels of alcohol use throughout their pregnancy, these are women who are more likely to have been drinking alcohol from an early age. They do reduce their alcohol consumption when they find out they're pregnant, but they really believe that it's very low risk to have occasional alcohol. And this was a study in 2022 that advised that this particular cohort, who are quite at risk, they need a more sophisticated health message that acknowledges, yes, we don't have great science about the exact risks of low-level alcohol use, but we also don't know that we know that there is no safe level. And so emphasising the importance of maximising health outcomes for the baby through abstinence could be another approach that sort of gets away from that issue of, well, surely one drink can't do that much harm. If a person does need support, it's important to consider referral to specialist services. It's also important to be aware of people's life circumstances and how that's going to impact on them. And, I think people are conditioned to minimise their alcohol use when they speak to professionals. No one who is drinking excessively is necessarily going to want to tell someone, that, particularly someone they've just met, because it's embarrassing. And unless they're seeking help, when it's really important to sort of listen to those messages. So also very important that people who are drinking at high levels, it shouldn't stop without medical supervision, as this can be very dangerous. In terms of advice for breastfeeding, there are some guidelines around waiting after a standard drink, expressing breast milk if you are consuming alcohol, and there's a FeedSafe app that can help women know when breast milk is alcohol-free. It's also important to advise about the increased risk of SIDS if there's co-sleeping and alcohol, because that's a pretty toxic combination. Every Moment Matters is the new national campaign, and there are a range of evidence-based brochures, posters, fact sheets that you can download and print out. There's free e-learning courses, and the website is there, and I'm sure you'll get a copy of that. For Aboriginal communities, Strongborn is a campaign that is part of this overall campaign to raise awareness of FASD and harms of drinking alcohol, particularly among Aboriginal and Torres Strait Islander people in rural and remote communities. And there's some great resources there that can be downloaded from the NACCHO website. If you want to learn more about how to talk about alcohol and pregnancy, there's other online training and resources as well. The FASD Hub has the GP Ask the Question and a number of FASD e-learning modules. And WA has a learning guide to use the Audit C. Okay, any questions or comments? Or we can hold questions till the end, whatever works better. Kate?
There's none in the chat box, so we might hold them till the end.
Sure.
At this stage. Thank you, that was great. So we might head off to the next presenter.
Thank you. Thanks, Prue. I'm going to try and follow up with from your expertise, and I shall share my slides as well. Can you all see and hear me okay at the moment?
Yes, we can hear you, and now, yep, now your slide's on the right format.
Excellent. Thank you very much. So yeah, a lot of what I'm going to say will support and echo Prue, which you'd obviously hope would be the case. I'm going to talk to you about my role with NoFASD and how that's evolved, but also around my own lived experience. Before I start, I will just say it's really important I perhaps give a bit of a safety warning, a psychological safety warning, because I will be sharing my own lived experience. And often when I do so, it surprises people around alcohol consumption, exposure, and just consider that NoFASD do have a helpline, which is operating 7 days a week, as well as our website for support. So I will just say that before I continue. As an organisation, NoFASD, as you heard at the beginning, stands for the National Organisation for Fetal Alcohol Spectrum Disorder. We are national. I'm based and have the pleasure of speaking today from Whadjuk Noongar Boodja in Perth, Western Australia. So it's not as late for me here as it is for you guys. And as an organisation, we will celebrate our 25th anniversary next year. The inception of the organisation was by a volunteer, several volunteers, who were parents and caregivers to individuals, and over an elongated journey discovered some of the factors that they were experiencing with their young people, and after visits to Canada and further processes were able to get diagnosis of what was then known as FAS, but we won't go there, we'll talk purely about FASD. So our role is to support families, please keep that in mind, and individuals, because if you are dealing with individuals who perhaps may have experienced a moment of concern around prenatal alcohol exposure or alcohol consumption during pregnancy, we are there for those individuals as well as providing support for services that engage with families and other organisations. So I would just like to touch on one of the slides that's similar to one that Prue shared with you, and that's because it's never too important to mention this twice. Prue was saying around the central nervous system, which we identify in this slide as brain and nerves at the top there, but it's developing through the whole period of pregnancy. But you can see here in the areas that are highlighted with red, the times when it's highly sensitive. Now, you heard what Prue said in her slides around the number of people who report drinking before they know they're pregnant, being 55% in the most recent data survey we have around the household drug and alcohol survey. Now, around about 80% of pregnancies aren't actually confirmed until 8 weeks. So when we are talking about the factors around stigma and shame and consumption of alcohol and how widely accepted it is within Australia and around the Western world particularly, it's really important to remember that many of those people and families who may have consumed alcohol had no idea they were pregnant. And once they knew they were pregnant, that they may have ceased alcohol use if they were able to do so. Prue touched on many of the reasons why somebody may not be able to do so. And they absolutely need support medically and supervision and support services as well if they are unable to stop. The other thing Prue mentioned, and something that I get often when I'm presenting or I'm in training or having meetings, is that people will say, yes, but people in Australia have been drinking alcohol for years. Why only now? Why are we hearing more? Well, I'm very pleased to say that thanks to funding and support through the Department of Health and Aged Care, and support from many other areas as well, there is more funding, and the Every Moment Matters campaign, which was launched back in 2021 now, I think that's right, gosh, at the end, it really has started to drive home that national awareness message, which is just fabulous to have out there. And as Prue's mentioned as well, there is also the online training that's available on the FARE website and through the Every Moment Matters campaign website as well. So I do encourage that. Now, coming back to this slide that's in front of us here, just looking at those periods that are highly sensitive and how things can occur and damage can have been caused without somebody knowing. Many of families that you may work with, I know you're in the primary health space, but if they are having teenagers or they have teenagers with them, or children, just keep in mind anybody who's over the age of sort of 13, 14, their parent may have actually looked at the previous guidelines that existed, and it was actually approved or deemed as safe, I think that's the right word, that you could have up to 2 units in a sitting and no more than 7 units in a week. So pre-2009, it was assumed to be okay to have low-level drinking, and it's taken a long time, even though with the new release of the 2020 guidelines from the NHMRC as well, to continue to get that message. And that's something that certainly FARE as an organisation, No FASD and the FASD Hub and other FASD related organisations continue to drive as well. So when we think about the gestational cycle in front of you, I'd then like to refer to my own personal experience. So this is my son. My husband and I had been married for 4 years when we fell pregnant. And whilst we had been planning to start trying for a baby, the timing was unintended. Had literally just stopped birth control and thought, oh gosh, I'm 30, it's going to take me at least 6 months. We've never tried for a baby before. Well, we were really, really lucky, and we fell for our first child immediately that we tried. Having no concept around the fact that that could be a case, so that was likely to happen. And I was a professional woman. I am a professional woman. I fit into that profile that Prue mentioned earlier as well, around reporting my alcohol usage to my GP when it was confirmed at 6.5 weeks, because I'm educated, I'm privileged that I live a life that is thankfully free of trauma and poverty, and I had read up about alcohol use. I checked the guidelines, and when I was planning to go ahead, I was able to have good nutrition. I used to socially smoke, and I'd stopped that a year before because I assumed that would be risky when I was considering planning. So there were many things I was able to do. I was able to make choices. And I remember very clearly saying to my GP when my pregnancy was confirmed at 6.5 weeks that I was really worried because there'd been 3 occasions that I could remember. I'm also keeping in mind what Prue shared with us too, and we know to be the case that we tend not to tell the whole truth or have we have imperfect memories when we talk about things that perhaps concern us. So 3 occasions that I know where I would have binge drank up to the 6.5 week mark. And that would have been with my friends and my husband, dinner, a bottle of wine. So probably, up to 8 units of alcohol across the period of the night on 3 occasions. Now, whilst I disclosed that information, it wasn't recorded anywhere, and the advice to me was to not continue to drink to that level. I was familiar with what the guidelines were because I'd already read about what I was going to do during my pregnancy, and I would measure 100 mils, because I knew that was a standard drink, of wine on a Friday evening as my relaxer with my husband. And we used to actually measure it together, so I didn't go a dot over, which still seems silly to me now when I think about it. But when you know better, you do better. So our son was born as a full-term baby. He was £9, pretty much had to be dragged out kicking and screaming. He was pretty cozy in there and didn't want to come out. And he was 9 out of 10 on the APGAR scale. So there were no warnings, there were no red flags. I didn't present with any alcohol concerns or misuse or dependency. I didn't have mental health concerns or issues. There were no other red flags that would have been seen at that point. Our son struggled to breastfeed. I put that down as being an anxious first-time mum and not getting it right. There's a little bit of self-blame there. And, you know, we moved to bottle feeding and, you know, expressing milk for a period of time there. He was really struggled settling to sleep. He struggled staying asleep. There were a number of factors as he was progressing through those early years, but he always met his milestones, his developmental milestones. So as each occurred, whilst he might have been at the very end of the safe or expected period for him, he did always meet them. Very engaging. I hope you can see that in these pictures here. Very happy young man, and would flirt terribly. I'm not sure that's changed now that he's 17 and a half either. But he was quite charismatic. So a number of the things and the behaviours that we would experience from him as he was growing up would often be masked. And in the school setting, something that's often very common for individuals with FASD is that they'll have behavioural symptoms of their brain-based disability due to the level of frustration they're experiencing, they're not having their needs met or accommodated or supported. Whereas for him, he flew under the radar, because he would continue to perhaps mirror what his friends were doing. He would continue to watch what they were doing and learn from that, and always sort of sailed just under the average mark academically. We were very fortunate that he didn't have extreme behavioural conditions or concerns at home. His emotional regulation and his affect regulation were both really pretty good. And with our ability to provide him with a sort of a strong structure at home, and we have raised both of our children with quite strong boundaries and structure around bedtimes and meal times, and how we've actually sort of positively parented in those spaces, that we were just lucky that there are a lot of positive protective factors. And I do say luck regularly, because we had no idea that FASD was a thing for him, or that it was going to be either. Educationally is probably his area where he struggled the most. And whilst we took him to developmental paediatricians, to an OT, and to a couple of different clinical psychs over the years, it was never picked up that, you know, his learning something one day and then not being able to retain it and forgetting it a day or so later, and many of the other factors that he would struggle with. There was never that much of a difference at that age that it became starkly obvious. When he got to about 11 years of age, that's when I usually describe it as the wheels fell off. And that was a point where sort of the expressive functioning usually increases in children as they develop, and his ability to be able to learn independently and autonomously suddenly became very apparent. He could no longer hide within the group. So transitioning to high school, whilst he actually managed very well, and transitions can be a really complex phase for many individuals, it became increasingly obvious as every month passed that there was a widening educational gap. We took him for further assessments. We were looking for specific language disorders, all of which he didn't have. But when we looked back with hindsight and knowledge at those assessments, what they did demonstrate is that he had significant impairment in several areas. Now, to us, not being FASD informed at that point, not having anybody ever questioned whether or not there could have been alcohol exposure, it wasn't on our radar. So whilst we were adding extra support, getting support through school, providing scaffolding and accommodations at home, and had individual education plans and extra learning support, there was no real answer for us, and we were looking for an answer. We needed to understand how and why we could support him. And as he was maturing more, as our first child, we were noticing with our younger child, who's 2.5 years younger and neurotypical, because I had a 2.5-year-old, which was pretty hectic. Socializing and drinking just wasn't a thing when I was pregnant with our younger son. It became obvious that our younger son was able to do more and had more capacity and capability to manage situations and daily activities than our older child. So that gap continued to grow as he progressed through those teenage years. And I really must add and amplify what Prue was saying before about the Audit C and about how that's used as a tool, and also those questions around alcohol use, because even retrospectively looking back at the Audit C, if the question isn't asked in the right way by a health professional or by myself as an individual looking at it to do my own sort of personal assessment, then my son's exposure would actually look like it was very low. But it actually would be classed as moderate because there were 3 occasions of binge drinking, even though that was in the earlier weeks of pregnancy. So really sort of give sort of thought to that. I would really encourage that. In terms of where he's at now and sort of where we've progressed, I joined NoFASD 5 years ago. And actually at the time, and again, I sort of smile because the reflection is quite funny now when I look back at it, ironic. I joined the organisation not in any way because I was looking for answers around FASD, but because I knew the CEO and I thought it was a fascinating area of work. And as I was going through the training and the research to deliver to other organisations, I had that stark reality of the lower minimum threshold for alcohol exposure in pregnancy. And that was when I was able to say, gosh, I've been saying he meets all of the red flags for FASD, but there was no alcohol. Then had that moment of realization around those early weeks. Once we had that realization, we could pull his existing assessments that he'd had, get a referral via a GP to a FASD informed paediatrician. And the FASD informed part is incredibly important. Sadly, to the helpline still, we will have phone calls from caregivers who likely aren't the biological parents at that point, who have taken their child and been on a wait list to see a paediatrician for many, many months, and they are still getting sometimes that response that there aren't any facial features. And as you heard Prue mention, 13% of individuals are actually only likely to have facial features. Unbelievably, with our son, and I don't know whether anyone can see any features in him, I can't when I look at these pictures, but when he had a final conclusive assessment report written, his eyes are a facial feature for him. So as he has matured and as his facial structure has grown, his eyes haven't grown at the same rate as his the rest of his facial structure, whereas we would never have realised that his eyes were smaller. So that has been our journey as we've progressed through those years. Whilst it's not something I'd love to be talking about, and for our son to have a FASD diagnosis, when we received the diagnosis, we were incredibly relieved, because what that meant for us is that all of the negative labels that had been given to him by others, and sometimes, dare I say, by us, because we felt he wasn't trying in certain areas, wasn't engaging, and it was about his behaviour and his personality. Once we had that diagnosis, the difference it meant to us, that is not that he wouldn't do things, it's that he couldn't do things, was a massive mental and emotional shift. It really brought us together as a family, and we were able to bring our younger son along with that, because he did experience a lot of bullying from his brother, and we had to work a lot on his resilience and ability to cope with that. Because we've been able to put supports in place and continue sort of guiding and being there for our son, we now are, at a place where he's been able to find an apprenticeship. It's a very hands-on physical apprenticeship. So for him, that's excellent, because he can learn. It's just that he needs to learn differently, and learning through auditory processing and reading is not his best way. He needs to be able to hands-on model and actually move through and work on different areas. So I'm happy to answer any questions when we get to the end about that. Just as I was mentioning before about the Every Moment Matters campaign, NoFASD Australia were involved in creating some of the priority group resources, and these were identified by the Department of Health and Aged Care in terms of what these resources should look like from a perspective of how they were targeted. So this was about supporting women at higher risk of alcohol exposed pregnancies. And we therefore decided the best route of support was to create a resource for alcohol and other drug workers, and then also a resource that they can utilise to support women to become alcohol-free during pregnancy. I will just give a shout out to Ange, who you'll hear from very shortly, because she was an absolute integral part of us being able to produce these resources, as was several other of our lived experience expert advisors, to really be able to give that lived experience and focus as to how these leaflets need to come across to ensure the support is there, it's honest, it's real, but it's not stigmatizing. And as an organisation, NoFASD, as I've said, we're there 7 days a week, 365 days a year. We've got a number of webinars and courses on our website, as well as the Australian Foundations in FASD online learning course. Bit of a shout out to Prue, because she's helped us to write that course based on the Australianisation, if you like, of the course. And it's evidence-based, and we also provide online caregiver and education and support groups, and a number of other services and information for people. A website full of resources. Here's a couple of those here. I keep moving my little photo of me around the screen, so I hope that you can, it's not blocking your view. The toolkit for parents and caregivers and families is really welcomed by many. We also have resources for adults and for the early years as well. Now, I think I told everyone I wouldn't go on too much, and I think I have. So at this point, I'm going to stop. And I'm going to pass over to Ange.
Thank you. So we'll just let Ange set up.
Can everybody hear me okay?
Yes, you're good.
Lovely. Hi, everybody, and thanks for being here. My name is Ange, and I am the mother of a biological child who's 14 years old, and he has diagnosed fetal alcohol spectrum disorder, or FASD. So I'd like to tell you a little bit about our journey. And I'd also like to, firstly, I'm coming from Wurundjeri country here in Melbourne. I would normally be in my lovely work office out the back, but my heater broke down and it's extremely cold here in Melbourne. So yeah, I'm in the house, and of course, my father is here and my 14-year-old are here. They both know, but of course with my 14-year-old, as Sophie has mentioned, there are some memory gaps. So he may come blasting in. That's great. You'll get to see how humorous he is before he realizes what's happening here. And I'd like to acknowledge everybody that's here. You know, as GPs and allied health professionals like that, you're often the first port of call, and you're also the lifeblood of any community. So my grandmother went to the same GP that my mother and father go to, and I go to, and now my son goes to the same GP. So yeah, as professionals, you're often the lifeblood of the community. And you're also often the first port of call, when women find out about their pregnancies. So I'd like to thank you for that. And I know that, you know, you work very long hours, and especially through COVID, it must have been extremely challenging. So I thank you for that. So I'm here to talk about, you know, how do we talk about alcohol or prenatal alcohol exposure, I'd like to call it, in pregnancy. And so a little bit about me. So I was born into a middle-class family, middle-class white family, obviously. My brother is 4 years younger than me. And I will also say that my story does come with a trigger warning for both child sexual, for a CSA warning. So at around the age of 8 years old, although my nuclear family was extremely stable, I was assaulted at the hands of somebody that I loved dearly and trusted with everything. And to protect my nuclear family from blowing up, I did not tell my mother or my father about that. At the age of 13, I then lost my virginity in a park against my will, and that was furtherance of that trauma that I experienced when I was younger. I've told this story a lot of times. I'm very open about it, so I do apologise if it seems very raw. It does occur to me that although I speak it, it may affect some people. And I can pretty much fast forward after that. Alcohol was just it was a really kind of interesting thing at about, you know, in the teens and stuff, you'd have a bit of a binge and throw up in the gutter. But I was completing my year 12. I was also heavily into sports, and it really wasn't my thing. And I've never liked the taste of it, only ever the effect. So into my late 20s, I started in with a social group that was a little bit younger than me, and they drank a little bit more than I did. And I was through my university course by then. I did early childhood education at the University of Melbourne. And it was about that point here in Victoria that there are a lot of early learning childhood centres that were popping up everywhere. And the demand for kindy teachers was dropping off, especially 3 and 4-year-old dedicated kinders. So I went into another field. But yes, so later on, yes, I found that I was sort of drinking a little bit more as a social lubricant, and it was helping me to fit in, which I now know was helping me to mask the trauma that I'd been through earlier. So at the age of 33, my mother received a diagnosis of glioblastoma. And talking to a medical professional, a lot of people, we all know that that's a non-survivable brain cancer. And she did subsequently pass away 14 months later. They got it really early, and she tried really hard. She gave it her best. But at about that point, my whole world imploded. My nuclear family, that was my safe place, had imploded anyway. And I turned to alcohol to self-medicate that. I very quickly got in trouble with it. I was a very work-orientated, high work ethic professional. And at this point, I was working at Melbourne Airport, and I was working very long hours with very high responsibility. And I ended up losing that job exactly 1 month prior to my mum's passing. And after mum passed, all bets were kind of off. And I became a 24/7 alcohol dependent pop-up drinker. I went into detox 3 times, into a short stay detox for 7 days. So I knew what alcohol detox, physical, from those kinds of levels felt like. And even, with the Valium, it was absolutely horrendous to come down from. So I knew what I was in for, basically. And I ended up going into a residential long stay. It was Odyssey House in Lower Plenty here in Victoria. And I was there for 5 months or so. When I came out, my son's father and I were looking at having children. I was 33 at this point, and we were having some problems. So we went and had some extensive testing done. And it came back as myself having a problem, as we suspected, because my son has 2 older half brothers. So it was, as we suspected, it was me. And that day I was told that without IVF, I would never be able to fall pregnant. And knowing how much, I wanted children, my mum so wanted grandchildren and everything, something inside me just broke. And I went back to medicating the way I knew how, which was drinking. And about probably 6 months after that, or thereabouts, when I was back to 24/7 top-up drinking, I found out that I was around about 10 weeks pregnant with what was to go on to be my miracle baby. And I was drinking at incredibly high levels. I was drinking 2 bottles of white wine, just the cheap stuff, a day, to try and avoid withdrawal by that point when I found out that I was pregnant. And I was one of I was, 2 things occurred to me. Firstly, I was absolutely elated, and then I was horrified because I realised the levels at which I was drinking. So when I went to my first OBGYN appointment, I did disclose. I told them that I was physically dependent upon alcohol, that I'd come out of rehab, that I'd relapsed, and I was back in full flight. And the response I got from that appointment was very short and very with tone, and it was that you must stop doing that, and you must be stopped by the time I see you next. We know, luckily enough, I knew that was life-threatening advice to both myself and my child, so I didn't go down that way. But what that actually did was it implanted a seed inside me that it was wrong to say this. And so I have A negative blood, or Rh negative blood, so I needed to have anti-D shots, and I went to every ultrasound and every appointment that I needed to go to. I took every prenatal vitamin, I exercised, I drank heaps of water, I slept as well as I could. My diet was impeccable. I didn't even eat soft cheeses or all the kind of coffee, all the stuff that you're not supposed to do. The one thing I couldn't do was completely stop drinking. And that first response had planted a seed within me that made me think it was not okay to tell anybody else at all. And that extended through to when my son was born. So I minimized, I dropped my alcohol exposure for him to less than, or just on or less than 1 bottle of wine a day, which was still 7 standard drinks. But anytime I tried to go any lower than that or jump off completely, both of us would get into trouble very quickly. And there were 4 occasions when I did this. 3 occasions I ended up having to go to hospital, the third at 33 weeks with a monitor on, and we stayed overnight because he was in trouble. And he was actually born in Bacchus Marsh Hospital, and they said they couldn't have him until 35 weeks. So we were able to get through that by, unfortunately, me going back to that minimal dose again. Then at 35 and 5, I had stopped drinking a couple of days prior to that again. I was just really done with it, and I was feeling so shameful. And I must add that I was looking on the internet for things to look for. I knew what was happening here, and I was trying to look for things, but all I could find at the time was fetal alcohol syndrome. So I was looking for facial features only, pretty much. That's all I could find. So yeah, when I stopped again at 35 and 6, I beg your pardon, my son was born. My water broke spontaneously this time. I went into a very quick labour. So unlike Sophie's baby, my son was born small. He was 5 pound 1.5. He required a feeding tube for 2 days, oxygen for 24 hours. His Apgar was low. It was 5 or 6. And we stayed in hospital. I was very grateful I was able to stay in hospital with him. I tried very hard to breastfeed, but he had a low suck reflex also. And so that is my son's birth story. So now I'd like to talk a little bit about where I went from there and the importance of GPs in the outcomes for these children. So fast forward to about 2 years of age, 2.5. Of course, at this point, our kids start to talk, and that's when I noticed that there was an expressive / receptive language delay in my son. He was not talking at the same rates that children of his age were. And by this point, I had been through recovery myself. So that's a story for another day. But yes, I have been through recovery, and am very grateful, and am doing the best I can for my son. So what happened first was I took him. His dad and I didn't ultimately work out, but we're both very dedicated as co-parents. And he's actually married to a lovely lady, and they foster children. So FASD is much more highly represented in the foster care system too. I think that's important to note, as well as our Aboriginal and Torres Strait Islander community, much higher than the national rate. So his dad actually took him off to a paediatrician, and even with the disclosure of alcohol consumption, his diagnosis was moderate autism. And to me, that didn't sit very well, because a lot of the symptoms, the stimming, lack of eye contact, although there's a lot of crossover, an awful lot. And on the NoFASD website, there's a really good graphic that shows you all of the crossover between FASD, ADHD, autism, and then the environmental ones such as conduct disorder, ODD, and all that kind of stuff. I took my son to a paediatrician for a second opinion, and I was really, really lucky that I did come across a FASD informed paediatrician who spent probably about 5 minutes with my kiddo at age 3 and a bit, and said, no, this is not autism, he definitely has FASD. And that's when he got his official diagnosis. So the next thing to do after that was to get him into early intervention. And the barriers I ran into there was that all of the early interventions, so as allied health, so speech therapy, occupational therapy, and later on psychology, when I called up, they were all very, very well versed in ASD interventions. But when I would say, what's sorry, my son's diagnosis is FASD, I would get a blank look and a what's that, which of course would lead to me having to tell my whole story again, which is quite traumatizing. But as I said, I've told it many, many times now. And I tell my story in the hopes that, you know, other mums don't have to sort of trailblaze in this fashion, because it is quite time consuming, and yeah, misdiagnosis can be quite expensive if it takes a long time to get around to FASD, and it's difficult on families, but it's particularly hard on the children because it does involve a lot of different testing. So to make my son's diagnosis official, he had neuropsychological testing. So that showed that his both deficits and strengths across there are 10 brain domains that are assessed in a neuropsych exam for diagnosis. And the importance of that, I guess, if there's going to be any referral on, is, you know, we're talking about how to ask about prenatal alcohol exposure. If I could suggest as a biological mum about how to ask about prenatal alcohol exposure, it is that we live in Australia. It's a drinking country. We're encouraged to drink. Melbourne in particular is considered the sporting capital, I believe. We see it on television all of the time. And the Every Moment Matters campaign is running. So there is a possibility that you will have patients that come in that are worried because they may have consumed alcohol and seen the Every Moment Matters campaign. So the best advice I could give on that front is to just be really open and honest with empathy and compassion. And I would merely say, you know, and how much alcohol do you drink, as opposed to do you drink alcohol? It sort of just feels a little less. And of course, people will still underreport. They'll absolutely underreport. I reported honestly, but I was desperate in that window of time, and quite often that window will close up really quickly if a judgmental approach is taken. So yeah, I really, really ask that you approach us with a very compassionate and empathetic stance when asking about it. But please do ask about it. So yeah, back to my son, I actually needed to train his occupational therapist with videos that I had actually trained myself in through COVID. I trained with a fellow based in Canada. And through that, I had access to all of the best researchers and all of the best people in the world, including a lady named Dr. Vanessa Spiller, who's in Queensland in this country, and she does a lot of work with the education of kids that have FASD. They need different accommodations and interventions than autistic children and anyone on the ASD spectrum. So I was lucky enough that he had presented some free videos, and I was able to show them to his occupational therapists and speech therapists, and they were really grateful to get them too. The important things to note is after they watched them, they both said, oh, wow, we're really glad we saw this, because we had been trained in autism. We were going to apply those techniques. And the reason we were going to do that is because with autism, there's often deliberate avoidance, and it involves a little bit of pushing, whereas with my child and all children with FASD, it's not that they won't, it's that they literally can't. So if they've given 150% and you ask them for more, that's when we see tables starting to get flipped, because, you know, it's very dysregulating to give your all and to still be asked for more. And often those kinds of ASD interventions will involve that. So they were both really grateful, and I'm grateful to them for taking it on board. So he was in a school that was a little bit too big for him, and it was also open plan. So he could hear all of the other classrooms, including his own. He was okay there until grade 2, and then things started to get a little bit abstract, and he was never a volatile child, but he did go to work refusal. So whilst he would go to school, he wouldn't open a book or pick up a pen or anything like that. So then he was transferred across to a much smaller mainstream primary school, school that I actually went to, and there were about 80 students. So it was just a straight prep, a 1-2, a 3-4, and a 5-6 composite with the same teachers the whole way through. They were able to accommodate him, and they put in things like a breakout room and asked him if he needed brain breaks. Kids with FASD get incredibly tired brains, and I'm sure that I know working at the airport I did, and I'm sure as health professionals, you guys have worked a double shift, and these kids are virtually working a double shift every day, just as a matter of course. So it's really, I give my son kudos for just being him every day, because it's twice as hard for him to do the stuff that I just take for granted. He's my little rock star. And yeah, so since he switched to the smaller mainstream school, he was doing really well. He was getting some wins. I was working with the school. He had an IEP. He was assigned no homework, because once he'd done with school, and he also had the 3 therapists, which was OT, speech and psychology in there as well. He's in high school now, and unfortunately nobody was able to accommodate him. So the way these kids test in the 10 brain domains I was talking about, they will test all over the place. So my son, for instance, is in the 86th percentile for some form of mathematics memory, which is why he towels us up at speech therapy when we're playing memory. They're Cadbury Dairy Milk cards. They're all purple, and there's 64 of them down with just a glass and a half. But both myself and his speech therapist know that once they've all been flipped and we flip the second, he's going to clear the board, because he's sitting in the 86th percentile there. Yet when it comes to reasoning, he's sitting in the 0.04th percentile, again within mathematics. So they are all over the place. Usually they'll test out to a low average IQ, which was how my son tested out, which put him out of specialist education and also disqualified him for an aid. So it's kind of important to note that had he had the autism diagnosis, he would have had exemptions for adaptive functioning and sensory needs and things like that to be able to go to specialist school. But because he has a FASD diagnosis, those exemptions didn't apply to him. So he's now sitting in, he's with a lot of recommendations from his psychologist. All of his allied health team are fabulous. And this is what I'm trying to get out, that we often look at deficits, and we have to in a medical field when we're looking at diagnosis and stuff like that. But there will always be at least one superpower as well that's just waiting to explode from these kids when they're given the right supports. And the right supports for the kiddos start with the right supports for their mums. Unfortunately, I had a really negative experience. I'm hoping that what I'm saying here will help you to understand a little bit about how, it is lifelong, but it doesn't need to be a life sentence. He's also with the Virtual Schools Victoria, they've been able to meet him exactly where he's at. So he, for the first time ever in his schooling life, is having wins. He's able to actually finish work that's assigned for him in the same day when it's supposed to be assigned, as opposed to not being able to complete his work and being kept in at recess. That used to happen to my son a lot. He would actually get kept in for what was his disability. So yeah, I've probably rambled on a lot. A really important thing that I like to say is that I'm a really open book when it comes to this stuff. My son knows what he has. He knows how it's caused. And because he was diagnosed at such a young age and has had the interventions in place, he hasn't known any different. And again, the best parting advice I can give is that if there has been prenatal alcohol exposure in any amount, please point your patients in the direction of the No FASD website, so that should FASD occur, when we come to diagnosis time at around the age 2.5, we can look for FASD first if there's been prenatal alcohol exposure, as opposed to it being the last thing when, as I said earlier, sometimes it's referred to as the alphabet soup diagnosis. It'll be autism and then ADHD, and then environmental things like, conduct disorder, oppositional defiance disorder, RAD or reactive attachment disorder. And yeah, it does put the kids through a lot of testing. And of course, there's in being trauma informed, of course, in some communities is really important. But I guess what is really important to note here is that everybody needs to know about the new guidelines. And it's especially important not to make assumptions, because I am sitting here presenting really, really well, But you know, I may be a person who has a couple of glasses of wine a night, and you may not think to ask me about that simply because of how I present. And yeah, so I would encourage everybody, if there is prenatal alcohol exposure, just to use compassion, empathy, to point people towards the No FASD website, because I looked really hard for stuff, and unfortunately for me, there was nothing to find. But as a parent, I would really, really like to be prepared should FASD occur, and I would really like it to be the correct and first diagnosis rather than the correct and last diagnosis later on into my child's teens, much like Sophie was saying, and there's interrupted school experiences. Last thing I'll say is, if there are any questions for me that you think I can't possibly ask that, please ask them. They're the questions I really want to hear. Thank you so much for listening.
Thank you very much. And, you know, I just want to commend you all on your passion for this area, and also for sharing your experiences. It's been, you know, really valuable. So there's a comment in here from Tiffany saying, thank you so much for sharing your stories. Your vulnerability has been very much appreciated, and I now feel a lot better informed, and I hope this will have a positive impact on my interactions with my clients moving forward. Thank you. So yes, that's it certainly has a powerful effect. And, you know, going through different things have been crossing my mind, and I'd encourage, we've got a small group here, but you can come on your mic and ask a question or make a comment or pop it in the chat box or share it. Either way is fine. And, you know, I just suppose that last discussion, Angeline, just, you know, made me question all of the diagnoses around ASD. You know, are we getting it wrong some of the time, you know, some of the time? Prue, do you want to pop your mic on?
Someone had to be first to be on mute. Sorry,
Yeah.
Ange, I didn't mean to cut you off, but working in the clinic where I work, nearly every child who comes in has had a flag for autism. And usually the outcome has been not quite autism. And that's when they come to us, because they don't quite fit.
Yeah.
Yeah, I also noted that the diagnosis of autism between, I think, 2015 and 2019 went up 21.6%, which could be explained by more services. And I did forget to mention earlier that the FASD is very much NDIS eligible. My son has an excellent plan that does pay for his 3 therapists, plus sensory tools that he needs. Also holiday programs. And I just wanted to say a final thing on my kid. I'm so proud of him. A couple of weeks ago, we were invited, his paediatrician is actually a paediatric examiner, and we were invited to a hospital where they were, paediatricians were sitting their final exams, and he was a test patient. So they were to examine him for 15 minutes. Last year we did a long one and I just yapped on. This year, they had to try and figure out what it was that my son had. And even at the level I drank, he only has those facial features that Sophie was talking about in her cutie. And yeah, so there were 3 examiners, and they were told 14 with dysmorphic facial features. And virtually, yeah, everyone wanted to send him for genetic testing. And even the 2 examiners, I wasn't aware until afterwards, but they didn't actually know what it was either. And only one of them had picked it. So it's very interesting to note that that in the lack of awareness, you're very much not alone, because there are paediatricians sitting their finals that don't know this stuff. Although I do believe, and Prue, you may know more about this, that autism is taught, I believe, in paediatrics more than FASD is. Yeah.
I don't know a lot, but I know at Monash Health where I work that you know, it's incorporated now into paediatric training, but that's partly because we have a diagnostic centre. So I still think that there are states and territories that don't have funded public FASD clinics, and just that availability makes a big difference.
As a psychologist, I recently, a couple of completed my training, this really hasn't been something. And where I work, we run alcohol and drug rehab programs as well, and this hasn't really been brought to my attention, to be honest, which is quite shocking. So I'm really glad to have joined today, and I do a lot of assessments around ASD, and I'm now just sort of reflecting, going, yeah, I do ask that question, but I sort of skim over it. So do you think that, because we talk a lot about children here, and how obviously the signs are going to start in childhood. What we're finding with ASD and ADHD symptoms, we're now getting a lot of adult referrals coming in, and people sort of reflecting on the information, looking back and going, this might have been something I've experienced my whole life, but I haven't really looked into it. Is there the possibility of that with FASD as well, do you think?
Definitely. Definitely. I mean, I always say when I'm doing training, anyone my age or older who's got FASD probably doesn't know it, because A, our mothers weren't told that alcohol was a risk, and B, there are no diagnostic options really for adults, very few and far between. And I've been in presentations where colleagues have come up to me in their 50s and said, I think I have FASD. And the indicators are, not good at school, always in trouble. It's not so much of a developmental delay that they might recall so much as just finding everything difficult and having a lot of conflict. And, now having worked in child protection, I look at a lot of the parents that I used to work with, and we would say they were not, didn't have great parenting capacity, but now I see it as more like a cognitive skill. They didn't have organisational planning skills. They couldn't figure out what time to leave home to get to their contact visit on time. So they would ring you at 10 o'clock on the bus saying, I'm on the bus for the 10 o'clock contact. And every week we'd be saying, I'm sorry, you're late. They're like, but I'm on my way. Because they knew that it was 10 o'clock, but they didn't know they needed to leave at 9, that kind of thing. And so I think there's enormous numbers of undiagnosed adults with FASD. And, they're often in the system, mental health system, or just chugging along, they've found a place where they're good at what they do, and, they've accommodated their challenges and found a job that suits them,
If I could add to that as well, to the No FASD helpline, one of the highest percentage of callers we have is adults currently. Over the last few months is adults phoning to say they think they may have FASD. And the difference with adults as well is they're likely to have found out, particularly if they lived in the, in the care system and been raised there. They're more likely to find out later that there was alcohol exposure. We've had people that have come to us that are 60, late 40s, early 50s. And it's often, as Prue's just said, they actually find out because they've had so many different adverse life experiences, always blame themselves for where they're at and their lack of ability, whereas actually they've done phenomenally well to get to where they've got to. If they haven't, ended up having many, many difficult life circumstances. And if I was to use my son as an example, who's 17 and a half, I won't go into detail, but we're in the process of needing to move house at the moment. And as we do so, we'll be needing to have somewhere with a bigger floor plan so that he can live interdependently. Because whilst he's able to hold down a job and go to work and do many other things, he will not manage with the day-to-day living skills at this point with budgeting and things like that. If he were to have a rental, it would not last more than a few months because they wouldn't manage the life skills that are required of them. Yeah. So
thank you. It's really helpful. And within those adults that potentially don't have the relationship or the knowledge to be able to ask their parents openly, if that was the case, how would you go about that? Like, is this sort of a referral to a neurologist to be able to actually check this, or where do you go from there?
Do you want me to take this one, or do you want to do this, Sophie?
Do you want to go and then I can follow? I'm happy.
So the thing about a neurologist is they would still need to have evidence of prenatal alcohol exposure. The only way that we can get a diagnosis without that is if the person has all 3 facial features. And unfortunately, as people get older, those facial features become a lot less distinct. So it might not be possible, not in childhood. But if the person's parents aren't around, I would be going to aunts and uncles. I would be going to people who knew their parents and saying, what do you remember? because that's often really the only source. And I do a lot of work with grandparents, ringing them up going, what can you remember from 12 years ago, 14 years ago? Do you remember what would have happened around that time? Did you see your son, your daughter, whoever, what was happening? And really pulling out that information. I think what we really want to do is highlight the importance of recording that at the time, because if someone had asked as a routine question, we wouldn't be doing all this digging. I spent hours a week going through files. You saw that one example I gave, and that's reading a maternity file with a fine-tooth comb, because alcohol was not recorded on that child's record, even though it was there for the first 4 to 5 weeks, and probably longer, because the mother didn't have good memory, and I don't think she actually found out she was pregnant quite that early. But anyway, checking facts and things. But when people around a family are aware and ask these questions more than once at the earliest opportunity and ask them in a non-stigmatizing way. I often play this great video of Insight with Jenny Brockie, where there's a mother talking about her alcohol use, and she was 18, she didn't know she was pregnant, she was in a car accident, and Jenny Brockie says, so how many drinks would you have had a day? You can see this one kind of wince and go, probably 10 or 15 drinks. And Jenny Brockie says, so what most teenagers would have been drinking at the time? And she just normalised it so beautifully that it took away all the sense of shame. She was immediately empathising with the woman. And your videos are great. I use Angie's videos on TikTok. And when I get those mums who come in and they're just shaking because, you know, they just don't want to have to go through their history, I'll go, hey, do you want to see this cool video of this birth mum from Melbourne? I know, she's awesome. And I pull up TikTok on my phone and go, she's like, you know, once you've drunk in pregnancy, it's true, there isn't anything you can do about it. But what you can do is you can advocate for your child. And so just the fact that you're willing to tell me you drank in pregnancy means your child is going to get support that they wouldn't have got if you hadn't done this. So you can't take away grief and shame because they're very real. And all people who experience addiction, I think, have a degree of shame. That's why it's such a cycle, because people constantly disappoint themselves and don't live up to their hopes and other people's expectations. And so it's a cycle. And if we can show parents that there's a way forward that is about acceptance of the past, we can't change the past, but we can change the future.
Yeah, can I just add, I'll just add to that, as a person who was living with addiction myself, I saw it at the time as the most, because addiction is obviously a very selfish entity and disease, and it's very far removed from my moral compass and as just what it does. But yeah, as you know, as a person living with addiction, it's, oh God, I forgot where I was going with that. I'm really sorry. Prue, can you help me? Like, where was I going?
We were talking about the shame and about asking and about not being able to fix the past, but being able to change the future.
Sorry. Yes. Because it was, I considered it did so many selfish things. I did so many selfish things. I considered this disclosure as the most selfless thing I could do for my miracle baby. And yeah, I was smacked down pretty hard. However, although I didn't disclose again, I just kept looking and going. And I was actually, it's really tricky and doesn't sit well with me to say that I was fortunate to be looking for it, because it's very shameful for me. But I do very much feel for people like Sophie, where there's no way to look for it at all, and it might be forgotten. So I'm very much in the camp of maybe pop it down as a birthmarker, much like cigarette smoking, and sort of normalize it that way. And then, as Prue was saying, adults could go to birth records that might have been, you know, to get this confirmation that they desperately need. My best friend has recently got confirmation from her mum, and she's going through a diagnostic process at the moment. So yeah, there's a lot of adults that are undiagnosed.
Great, that's really helpful, everyone. Thank you so much.
Thanks, Tiffany.
I'll just say quickly, we didn't mention prevalence at all. I think everyone thought someone else would, but the statistics we look at are, you know, conservatively 1%, probably realistically more like 2 to 5% of the population in Australia are likely to have FASD. So when we compare that to autism, it's probably a little higher.
So, are there? I think I sort of know, can predict the answer to this. Are there barriers in terms of our, it's our drinking culture? It's women who are the mums and having the baby. Are there sort of I guess cultural, social barriers to actually addressing it more fully? Basically, we need to be doing more, but it sounds like there must be these barriers in place.
I mean, I don't know if you want to say something, Sophie, from the No FASD angle.
Yeah, I suppose, thanks, Prue. I think probably one of the things I would just say is, and I think Ange feels this, I feel this, any other biological parent you talk to, the stigma that's related to FASD and having an opportunity to speak about lived experience, I found quite cathartic. But I think it surprises people that you're willing to talk about it. But I think both Ange and I feel quite similar in this space, that if we're not sharing, how do you continue to get that message out there? And it's identified as one of the most stigmatizing disabilities for the individual and for the parent. And until we can address that, until we start to be able to share that, talk about it more, the National Awareness Campaign has been and will continue to be a strong presence, which does mean that, the message is getting out there. But as an educated Caucasian woman, I followed guidelines at the time, but I also made my own decisions, and I knew I wanted to drink alcohol. So that's why I checked the guidelines, because I wanted to see what a safe level would be. I just had no idea about the bit before pregnancy. And there is still so much misinformation out there, sadly through public health forums as well. That's not targeted here and anyone that's here today, but also in society through peer groups and through generations. And Prue even alluded to the Guinness campaign from years ago, and the messages that still linger. So there's much to be done.
Stout in pregnancy,
I certainly remember my mother saying, when I had the baby and was breastfeeding at home those first weeks, she said, the best thing is to have a stout and lemonade in the evening. That'll help you sleep.
Yeah, definitely would have.
Yeah.
And I think with your point, Sophie, that there's a lot of we have internalized shame ourselves around the idea of drinking in pregnancy that makes us reluctant to raise it with people. Because it's like, oh well, is this person going to think that I think they're a drinker? You know what I mean? And I think even, people I'm sure say to you, Sophie and Angeline, oh, you're so brave telling your story. And what that says to me is, because I wouldn't, that's very out there of you. I mean, I'm, parroting, but, it's when we think that it's brave to tell a personal story, it's because we have an internalized sense of that there is a shameful factor in it, and I think we have, until we can destigmatize and go, thank you for telling the story, that's really useful information, because I wasn't aware of that, rather than having this emotional, I think we really are worried about women feeling judged to be asked about drinking, and that leads to people not asking at all.
Yeah, thank you.
And I will mention just one more comment because I know we need to go.
Last one, yep.
A national prevalence study is needed so that we actually can ascertain what the numbers are in Australia. We base our figures on US and Canadian studies, and as Prue alluded to, some of the assessment criteria and diagnostic criteria is different, and therefore we don't have a clear figure for Australia. So that's my closing comment. Thank you, everybody.
Thank you. And I'll just share a comment in the chat box from Rebecca as well, thanking everyone for their knowledge and experience, and to the funders, FARE, for making this possible. And we look forward to sharing the event with our health professional networks, etc. So that's wonderful.
Very last one from me. Sorry. Very last one. Wherever alcohol is, FASD will follow, and it crosses all socioeconomic lines. That's and groups.
It's a good final message. Thank you. So thank you to all our presenters. And thank you to the Foundation for Alcohol Research and Education for this evening. There will be, Aaliyah will send out an email that'll have information about an evaluation and some resources for participants. So thank you very much, everyone, and good night.
And thank you, Kate, for facilitating.
Pleasure.
Thank you.
Thanks very much for the opportunity.
Thank you.
Thank you all. Great presentation.
Thanks, everyone.